Liz is here. My pronouns are she, her, and I am so excited to kind of share some things that have helped me along my journey navigating the healthcare system here in Los Angeles, but the rules apply to the state in general. This chat today will mostly be about low income insurance. We're not going to go into details. I'm not a health expert, but I am a health advocate, and I myself, as an example, have been through a lot so far. Had an interesting journey already, but some things were just difficult for no reason, and difficult just because I just didn't know any better. Hi there. I like your name. That's funny. So I just thought that I feel called to use the things that I've learned and just kind of share it. I don't have captions right now, but I already have actually put this on my Patreon. If you think this information, if you think Stay Light with Liz gives and offers something really valuable and you want to contribute, you can go to patreon.com. We'll put that in the link here in the comments in a second, but patreon.com, just Stay Light with Liz. There's $3, $5, and $25 options, but you can always choose your own amount, sliding scale. Which brings us to Navigating Healthcare in LA Low Income Edition. Did you know if you're low income, there's a sliding scale for health insurance? I didn't know that. I was in the past, a few years ago, working 3 or 4 jobs, and none of them offer health insurance because part-time rarely does that. And I just went without health insurance. I aged out of my using the health insurance that my parents had. But in my mind thought, okay, health insurance is really expensive if you're paying out of pocket. My employers, I don't have like a 9-to-5 place that offers health insurance. So I just don't think health insurance is for me right now. I'm in my 20s. I think that I'm relatively healthy. I'll just kind of wing it for now. But that was a big mistake. And I'll tell you why in just a moment. Hello, echo. So there's 2 ways to get insurance. One is from your employer, and one is by purchasing it yourself, and that's what we're going to talk about. Most of us don't get health insurance through employment, or some of us might be unemployed. What do you do if you're unemployed? Hi there. If you're unemployed, you still should have health insurance. You still deserve health insurance. You're still a human being. You still need care. So it's super important what we're going to talk about tonight. Thanks to Obama, we have Covered California. Covered California is where we will go to sign up for health insurance. If you make over I'm looking at my notes here. If you make over 1,700, annually, 17,600 annually. You can choose from a variety of insurance plans at coveredcalifornia.com. Again, all these notes are already on my Patreon, free to the public, but if you want to contribute, you're welcome to do that. So on that website, you'll enter in your income and it'll automatically give you a sliding scale. So for example, my insurance that I chose was Kaiser. I've always had good experiences with Kaiser. To my understanding, Kaiser is like one of the top dogs here in California. Kaiser seems really awesome. It would have been like $450 a month. And that's what I was thinking. My assumption was actually that it would have been $600, $700, $800 a month. I just never really looked into it. Just thought that that's how much it would be. But with my sliding scale, basically, I only pay $169 a month. Now, I'm not saying $169 a month is super attainable for everyone, but that's a huge gap between the $450 and the $169. It makes it a little bit more accessible. We are still responsible for copays and co-insurance. Copays are usually about $15. So each time you go to an appointment, they might charge you like $15. And co-insurance, which I did not know what co-insurance was. So co-insurance means your insurance pays a certain amount, let's say 80% of the treatment, the bills, and you pay the 20%. So although I'm paying $169 a month, and I'd still have to pay, say, 20% of the treatment, I'm saving 80% of treatment all year long. So it evens out. I mean, it actually is beneficial to get this done. It'll still save tons of money. If you make under that amount, that 17,000, I think it's annually, 609, you'll qualify for Medi-Cal. So Medi-Cal will cover all your expenses. Hi, sister. Including copays and insurance. So that's what I was on up until recently. So Medi-Cal basically is like government assistance, health insurance. But I want to right now squash the stigma between getting assistance when you need it. We're all paying into this system. So if you actually qualify just by that one number, don't feel bad for using it. I was kind of like, no, I can make it work. No, honey. No. If you qualify, use it. That's what it's there for. It's not you taking advantage of the system. Actually, I beg to differ. If you're healthier and you're taken care of, you can then go to keep thriving, even financially, and very soon not need the Medi-Cal, which is what happened to me. I was on Medi-Cal, super low income, had a lot of symptoms that by the time I was with my partner for a while, she was like, girl, something's wrong with you. She's involved. We'll talk about her in a second, but my partner, Laura, is amazing. But she's involved. She's an essential worker, healthcare worker working in a clinic. So she was like, I just recognize that something's wrong with you. This isn't just anxiety or depression or whatever. Something's wrong with you, girl. So she's like, you need to go get checked out. You can actually apply for Medi-Cal. And she helped me sign up. So going through the appointments and testing, I actually had a whole full-blown thyroid disease, like an autoimmune disease. Your thyroid is a gland right here. It looks like a little butterfly. It actually is associated with the 7th, 6th, 5th chakra. Has to do with communication, but also think about how much we eat and throw up and drink. Like a lot of stuff happens right here. It's about expressing ourselves. But the thyroid actually is like the conductor to your organ. So like a really vague example, like if the liver needs something, the thyroid says, okay, then you're going to get it from this one. If this organ needs something, the thyroid says, okay, I'm going to balance your hormones over here. It's all hormone levels. So it affects your heart rate, your breathing, your sleeping. You could be sweating. There's just a lot of symptoms that could be masked as other symptoms, like just from generalized anxiety or just being high strung or personality. But having the distinction from the test results made all the difference. It's not just about taking a breath and calming down. My body itself is doing this thing. And so I needed medication, and now I don't need it at the moment. Although I did get test results today that says that my thyroid might be a little bit off today. So we'll talk about how to set up an appointment for that. Let's see. Trying to see where I left off. So in my experience, the support of Medi-Cal is amazing. It's amazing that you can be low income, like have no job, and still get medical services. This is a blessing. And even though the service might not be the best, it's still a blessing. So one, we need to recognize that we live in a place where that is possible, and the blessing that is. Now, that doesn't mean the customer service is going to be awesome. The first thyroid specialist I had was really unprofessional. It was a really dingy office. I walked in trying to give it a try. I feel like I waited for a very long time, like an hour or two past my appointment time. By the time I was starting to be seen, the doctor was like really sweaty and her hair was like pasted to her face from sweat. She seemed very disheveled. She had like band-aids falling off of her ankles and stuff. She just seemed like a mess. And when she walked in, she asked, oh, hi, Carmen, how are you? Like, I'm not Carmen. Mistake number one, I feel like you don't see me. I feel like you're not taking care of my medical record. First of all, where is my paper if you think I'm Carmen? So that just very much was the wrong, inappropriate mistake that happened on her end. Whatever, we got over it, continued the appointment. But the first question she asked after realizing I'm not Carmen, I'm Elizabeth, was, she said, where were you born? Look, you don't ask people in Los Angeles. Everyone in that office was brown. All the students were our students. All the patients were brown. You don't ask people where were you born? Like, that's not how you introduce yourself. To me, even though I'm a citizen, that caused a lot of like trigger and like anxiety in me. Where were you born? I said, why does it matter? And then she explained because certain diseases are, more prevalent if you're from or have been spending time in other places. I like, thyroid has nothing to do with that. I didn't answer her question. So here again is where you can advocate for yourself. If you don't feel comfortable, stop. Ask for clarity. Don't let someone rush you. Ask for all the time and clarity that you need. There's always more than one office for things like this. So don't feel like all the power is in that doctor's hands. So long story short, I called Medi-Cal back after that and said, I won't be seeing her again. I really need for you to change my office. And there's no problem with doing that. They have a whole list. They just picked the person that was closest to me. So another tidbit is that the closest doctor might not always be the best doctor for you. The next option was a doctor that was in Tarzana or something, like 30 miles out. I had a car, I had time. So my appointments, I would travel. And it was a beautiful office, super professional, expert type feelings. And I just felt so much safer, which allowed me to be more honest and get the treatment that I needed. So you can choose what works best for you. Okay, so let's say you have Medi-Cal. You need to tell them which office that you choose. So it's called assigning. I highly recommend, if you are queer in Los Angeles, to assign your doctor's office at the LA LGBT Center in Hollywood. It's a super safe space. If you're queer, we are more targeted and we have a lot more mistreatment in the health field, in the health offices, which means that we won't be treated correctly sometimes. So if there's some homophobic doctor, they're just a person. A doctor is just a person. If they're homophobic, they're going to bring that into their work most likely. And we see this all the time through statistics, let alone like Black woman, queer. There's a lot of things against us. So this place has just been a godsend to me because you walk in just knowing, first of all, you're super protected. Everyone around you is the same. The person checking you in is trans. The doctor is gay. Like, you're at home. So that at least is safe. The playing field is evened out for us. I really, really like the LA LGBT Center. For as many things as I can, I go there. They have primary medical doctors. They have mental health services, although it's not the fastest. They have their own pharmacy. And if you're queer, whether you are cool with your current doctor elsewhere or not, I think being familiar with the center is really important because they do host events and education and resources. Like if you're homeless or going through something, like there's just so many resources that's really important. Even if it's not for you, it can be for someone else. Hi, Armin. Okay, Armin, first of all, I follow you all the time. So fangirl right here, no pressure. So if you don't feel safe in your current office and you're queer, try the LA LGBT Center. There's a lot going on. I already know behind the scenes, but a really, really, really cool resource. So at the center, another tidbit from the queer category that we're in right now with health, you can receive PrEP. PrEP is the preventative HIV medicine. Did you know that? Did you know there's a medicine now that's just like available? You can just like go set up a few appointments and you can receive medicine that will make you super resistant to contracting HIV. Can you imagine in the 90s if we knew that? Crazy. Cool. Crazy cool. Hi, Nikki. So HIV is no longer a death sentence, but it does come with its own set of challenges. So we still want to avoid contracting and spreading it as much as possible. I will never forget when my partner, who was formerly the sexual health clinic supervisor of both locations. So there's a WeHo and a Hollywood location for the LA LGBT Center. And so they do the sexual, I think what they call it, sexual testing. So she was like the boss of all that. So she knows about the statistics, and the statistics are crazy still for these numbers. 1 in 4 brown gay males will contract HIV. 1 in 4. Guess what the statistic is for black people in the same category? 1 and 2. That's 50%. That's insane. That's fixable now. Now we have resources. Now we have education. I'm hoping this can help. PrEP is just a pill that you take, and it helps you be resistant. And so if you are looking for PrEP, all you do is call up an enrollment worker at the LA LGBT Center. The phone number for the PrEP hotline is 323-993-8990, 323-993-8990. And this is on my Patreon for free, open to the public, all this information written down. I just want to reiterate that there is a few steps to this, because it seems very confusing, and as a patient it's confusing to me. So I want to normalize it from what I've been watching my partner, who's now an enrollment worker. Being the boss was like way too stressful. So we went to doing enrollment worker. She's actually specialized and has a degree in HIV care specialty. So super cool person. So if you call, you might get her. Hopefully you will get her. Trust. But you're going to be set up with the labs. That's to check your liver, your kidneys, and your status, which is your HIV status. You'll also make an appointment with your enrollment worker to speak to a doctor so they can brief you on the medication, tell you how to take it, give you warning signals, tell you the side effects. And the doctor writes the prescription that you'll go pick up in the pharmacy downstairs. So it's all in one space. But most of us will qualify for the PrEP assistance enrollment. What's it called? Hang on one second. PrEP assistance program, because PrEP is like super expensive. I think it's like $1,800 a month. So that's not accessible. That's not going to help make this a preventable issue if it's $1,800 a month. So the manufacturer actually helps out. If you make $84,000 as a family of 2 or under, you qualify for all your related labs and appointments for PrEP is covered. But if you're single, as long as you make under $63,800, you'll qualify. So that's most of us. So that'll cover everything. So that's super, super, super important. So if you are at high risk or using unprotected sex at all, this is like we just need to normalize this. It's right there. Just go make an appointment. Check out that hotline. So let's go back to primary care, because I myself didn't know about any of this stuff. I didn't understand how it worked. My mom back in the day would just make an appointment. We just kind of go. She never really explained anything and never caught on. So you sign up for your insurance, whether you went to Medi-Cal or you just picked like a sliding scale plan, basically. On all of it's through Covered California. So you'll get Medi-Cal if you're under that certain amount, or you'll pick a low payment plan with a sliding scale, purchasing your own insurance, and then you assign your doctor's office. Next is you call and set up an appointment yourself to your primary doctor. So your primary doctor is like your main doctor. It's like your home base. And then in that appointment, now it's usually over the phone, you tell them what's wrong, or if you just need routine checkups. I highly suggest that everyone check their vitamin and mineral levels, check everything you can think of, ask for everything you can think of, but most important, I believe, would be iron, calcium, checking your blood sugar, for diabetes, your glucose levels, vitamin B and vitamin D. I was super deficient on vitamin D, and thyroid. I don't know if it's standard to do thyroid. I feel like it's not. But your thyroid's super important, and it often explains some things that are kind of like an invisible illness otherwise, or you might contribute again to just anxiety or being stressed. But please check those things for sure. Tell your doctor, I need a blood test for this, and this. And they should be like, okay. There are a couple things that my doctor, even at the center, said, no, I won't test you for that. And that was sex hormones, which I heard from the internet can really help if you're experiencing depression and everything like that to check those just might be off, but she refused, so that was kind of irritating. But now I figured out what was wrong with me anyway. So get those blood tests. Your doctor will usually send that digitally to a lab. Now if you're in a place like the LA LGBT Center, hi dad, that means that the lab is in-house in the same building. You just go downstairs or to the other room. It's super cool. In some doctors' offices, clinics, you might be sent out to a third party or a party that they choose. So you just basically go to another location. You might have to make that appointment too and get your blood drawn. You sometimes it's walk-in basis. Sometimes you have to make an appointment. So you have to be the advocate. Your doctor is not going to call and make a lab appointment for you. You have to call and do this every step of the way. Hi, Alina. I see you. Oh, everyone's here. I love it. Love, love, love it. So let's see. Right. Do not wait for the doctor to call you back. The lab results, once the lab does your blood test, you've already gone home. It might be a couple days, maybe a week. But then the lab sends the results to the doctor's office. Don't wait for your doctor to call you. Hey, I got your results. Let's talk. You call them. If they're like, hey, I haven't gotten yet, cool. You call them. You will be waiting for months, forever. They're not case managers. And that's what I really had to get my brain around. No one's going to do this for you. You have to be your own advocate. You have to be on top of it. You have to assume that mistakes are going to be made on the other end. So you have to be on top of it. This is your health. If the results in the initial appointment for the doctor calls for a specialty doctor, like in my case with my thyroid disease, your primary doctor will then refer you to a specialist. Again, you have to call and set up that appointment. It's helpful to bring in all your results printed out so you can be like, here, this is what's going on, instead of like, let me sign in real quick, or I don't know, I don't remember. Just if you have it printed off like this, you're just ready to go. And likely a specialist is going to be in another facility unless you're just in a really big hospital or something. I have had my specialist give me my orders. Sorry, let me back up. If you go to a specialist, they often want their own lab. So even though I did my labs with my primary care doctor, I went to my specialist and she was like, I need my own labs. And I think there were some extra things on there too, and they want their own verification, maybe for liability reasons. So in my case, I was sent to a third-party walk-in. It's called Quest, a walk-in place where you just go get your blood drawn. But they gave me the piece of paper, and I handed it to them. A lab order is just like an order in a restaurant, right? So they have to put in the order, but you have to go do the appointment and pick it up. So then the results were sent to my doctor. I had to make the appointment, or your doctor specialist might make the appointment before you leave when you see them, before you see the labs. But if the appointment's not set, you have to make sure you're doing the follow-up appointment to review your labs with your doctor. Your specialty doctor might also prescribe medications. Again, you tell them where the pharmacy is best for you. Usually they look that up through the pharmacy name, address, and phone number seems to be used a lot to identify a pharmacy. So if you have those ready before you walk in, you're just like good to go. You don't want to be in your office like researching what's the closest CVS or whatever. Again, if you're queer, I suggest using the LA LGBT Center if it's close to you, if it's close enough. It's in like the heart of Hollywood. And it's time sensitive. So don't get a prescription and then forget about it for 30 days. It'll be expired and you have to do all this over again maybe. And your blood work might change. So if you're getting a prescription because your levels are a certain way now, 1 month, 2 months, 3 months later, you're going to be different. So you want to make sure you're on top of it time-wise. So does that make sense? Hopefully it does. You have a primary care doctor. They have to be the one to do anything for you. They can prescribe their own medications or they can refer you out to specialty people. But you have to call and make all the appointments and advocate for yourself. So let's go to a different sector now and talk about mental health. So to sign up for mental health therapy through your own insurance or through Medi-Cal, you call the mental health line for them or go to the main line and you can be directed, but you might be on hold for a while. You'll have a first appointment, which is an intake. It's kind of like a questionnaire. It's kind of just like laying the ground. You can share as much as you want, but this isn't where we're going to work on coping tools. It's someone will hear you out. You can cry, do whatever you need to do, but it's mostly them just getting background information. Then, depending, they might set you up with a psychiatrist, which is a doctor who can more diagnose and give medications for what's going on with you. And again, you tell them where to send the meds and you pick it up as soon as you can. With mental health medicine, you have to take it religiously. If you don't want to take it anymore, that's completely your right, but don't go cold turkey. Like I did that once. I was like, oh, I'm just tired taking this. It's not working. And I didn't wean off. I just stopped taking it. And it's the serotonin levels for the medicine I was on. The levels in the brain, it just throws you off and you'll be sick. I was horribly sick. Couldn't lift my head. I couldn't like go to work or do school or anything. I could only sip on Sprite from McDonald's at the time. That's the only thing that I could keep down. So please don't start medication and just stop it. You can stop if you want to, just wean off. And the doctor will likely set you up with a therapist, like a talk therapist. So that's 3 people. So it's 3 different appointments that you have to make sure that you're keeping in line. They should be really good at being the liaison, but don't rely on that. So likely these 3 different like departments essentially are going to talk to you individually. So you need to communicate what's going on also. And they also might give you resources like classes or webinars, which is really cool. If you want to talk to someone outside of this whole system, there are people. Hi, Nicole. There are people. There's someone who I use. She's so amazing and so sweet, and she makes you feel so safe and grounded. Talk therapy and Reiki virtual. Honored Intuition on Instagram. And just to recap, again, all of this that we're talking about is on my Patreon for free right now. If you want to join, you can. But it's patreon.com/daylightwithliz. So we're almost there to the end. If you have any questions, you can let me know. But I just want to take a little note real quick that sometimes you will be on hold for a long time. When I call Kaiser's main line, it's usually like an hour wait. Luckily, they have a callback system, so I can just put my name and number and go do something else, and they call me when someone's ready, so that's amazing. But I actually realized to set up an appointment, I could have just done it online, and it took like 2 seconds. So now that I know that, I don't have to waste my time doing that. Now, here's some chisme, which means gossip in Spanish, right? Here's like the lowdown. I caught someone being like real kind of shady to me. I'm real like defensive when it comes to my healthcare now. Like, don't play with me. Don't tell me the wrong thing. Don't pass me, wave me off, because I'm not here for that. The other day, I had already talked to my primary doctor, let her know that I'm looking for blood work and such, but also mental health therapy. So she gave me the number, but I got the number wrong. No problem. I called the main line to ask for the main number to be transferred. It was an hour wait on the main line again. So I got the call back. When somebody called me back, she sounded real flustered. She sounded like she was in a car. So I was like, okay, that's weird. I know this is not right already, because you should be in an office, chill, calm down. Like, what are you doing? But I told her, hi, I need to make a lab appointment. My doctor has put in orders and I need to make an appointment to get my blood drawn. Somewhere in there, she misunderstood what I was saying and I said, okay, cool, let me put you on hold for another 20 minutes. She answered the phone like, hello? Like she forgot about me, I think. Oh yeah, okay, you're all set up. The doctor will call you in 24 hours. Red flag. Why is the doctor gonna call me back? Doctors don't make lab appointments. The doctor already did what they're supposed to do. The doctor's gonna send the orders out for the lab, and then you go do the lab, do the blood draw, make the appointment, do the draw, get the results sent to your doctor. You make an appointment to reconvene with the doctor. Doctor doesn't talk to you again until you have the results and you make an appointment. Why would I go in a circle to talk to the doctor again to make a lab appointment? I knew this was wrong on the phone. I only knew and didn't accept her answer because of the experience and the practice already in hearing about my partner dealing with insurances and such. So I just knew this wasn't right. It was such a red flag. And so I stopped her. I said, no, I'm very confused. I've already spoken to my doctor. She's already put in the orders. I need to make a lab appointment. She kept waving me off again. She sounded like she was on the freeway or something, like a Kaiser person. And she said, yes, like, yes, the doctor will call you in 24 hours. Okay, you're not listening. Hi, Daryl. You're not listening. So hung up with her. Instead of calling the main line back and hopefully getting somebody else, I said, when I called the mental health services, they answered right away. So let me call them back and speak to a human, and they should have a directory on file. And lo and behold, they answered in 10 seconds. And I got the answer that I needed. I called the lab, and the appointment was made in 10 minutes tops. So instead of just listening to her and her misunderstanding or her lack of listening, I would have waited 24 to 48 hours to then get a doctor's appointment call that was never scheduled, by the way. I don't know what she was doing. Then figuring out to make the right number to make the call. This would have been 2 days lag, 2 days of extra stuff. But from the experience now, I realized you need to get help whoever you need to get it from. And then the appointment was made. I've already gotten all my test results back now 2 days later. 1 day later, 2 days later. So that's just an example of what I mean. Don't just take everything that they're saying from, by word. We understand how this process goes. So if somebody's telling you elsewhere, telling you something else, advocate needs to turn on, like, this isn't the right process. Usually the person on the end of the line is not the only person. So you don't have to, again, the one person is not the power holder. Call someone else, get clarification. This is your health. These people are, one, overworked. They are indoors all day with fluorescent lighting. They're looking at computers and papers all day. They're dealing with insurance. That's not fun for anyone. So my conduct advice when you're dealing with people is to be really kind and gracious. Just see them for the overworked humans that they are. Be friendly and watch how their attitudes change, and then thank them for their graciousness and for their help. Yeah, that one got me hyped. I don't want to say get defensive, get hype, but when it comes to you and your health, you need to be ruthless. You need to be ruthless. Don't be, okay, I'll wait. You can't be timid or submissive. Okay, well, that one lady said the doctor's not supposed to call you twice. So she's wrong. I think she was late or doing something fishy or something, Let's talk about dental care. So it's the same deal as dental insurance. You go to Covered California, pick a dental plan that works for you. They're basically, as far as price, basically all the same. Within $10, I pay about $47 a month. Now, when you get insurance, if it's like mine, it will have a grace period, or it's not really gracious, but you can't get any major work done for 6 months. So you can't be like, oh, I have a root canal to do, I have major surgery to do, let me go get insurance, and then the next day I can go get all this work done to save money. It doesn't work like that with dental insurance. So you'd have to wait the 6 months. And there's also, for the major things, the smaller things you can get done immediately, like little cavities or cleaning. But there's also a very low max. So mine is $1,500 per year. So once I've used up $1,500 worth of insurance, that's it. Everything else is still out of pocket. So I had recently needed semi-urgent care, 2 potential root canals, a few cavities, and just general cleaning. Because of all that time that I wasn't taking care of myself and thought I could just get away with not having insurance, not good. So it all caught up to me. So I was able to get insurance and get the minor work like the cavities and cleaning covered. But there's that co-insurance that we talked about. So I believe mine is 20% for dental. I'll still have to pay, but that 80% is covered. Now for the root canals that I needed, I would have to pay completely out of pocket because I'm not going to wait 6 more months and have my mouth go to crap. So I said, do what you need to do. I don't care if it's $10,000. I have to have my mouth right. Your mouth has a lot to do with your whole body's health, since so much of it goes into your body. Do not take dental work lightly. Be really consistent. Floss, right? Be really consistent because it affects the whole body. It's a very quick way to get infections and everything throughout your whole body is the decay in the teeth. So super important. So a lot of it with dental work is out of pocket. No problem. They have payment plans. It's basically through the dental office. They help you sign up for a loan that you can pay low monthly payments or lower, and depending on your credit score, your interest rate. Now, to be honest, my credit score is like 650 right now. It's went up about 100 points since those days of not taking care of myself. I paid everything off that was in collections. Yes, I was in collections. Not too bad. But I paid it off, so my credit got a little better. And I was able to get a payment plan, which is very fortunate. It's very easy to mess up your credit. I messed up my credit over $1,000 bill. So the payment plan would have been fine, but there was a high interest rate, which now that I'm trying to learn about stocks and investing, every penny, every 50 cents counts. Every dollar counts, right? Because if you put $1 in some high yield investment thing now, 20 years, that $1 could be a substantial amount. So I wasn't down to just sign and say, cool, interest, let me go home and talk to my partner and see what's up. Because in my case, she has almost perfect credit, we were able to get the same loan and a low payment each month with no interest. So in my case, it worked out that way because I happen to have a resource, a support system to get this done. And as a couple, it just made sense because we share the same household that interest would be interest money goes somewhere else, like savings or paying off the actual bill. So again, finesse the situation. The last few tidbits that I want to say is that healthcare is urgent. Healthcare should be a birthright. And particularly here in this state, we are now familiar with a lot of resources. So I really urge you not to just rely on assumptions like I did and let your healthcare needs just be kind of pushed aside, because they won't go away. They'll just start to build on themselves. Like my thyroid disease was out of control, off the charts. And now I have all this dental work to do. It's not going to go away. Just take care of yourself. Please, please, please. I know it's really, really hard. And even still, these numbers, paying $300-$400 a month for the actual bills, that's a lot. $400 divided by an average $10 here. Minimum wage after taxes is 40 hours. It's a week's worth of work for an average person to pay this. I just can't reiterate how important it still is. So if you're low income, go to that certain amount, $17,000 a year roughly, go to Medi-Cal. Please don't wait. Keep looking, keep asking so the information can find you. So we talked about Covered California, how you can go to Medi-Cal if you earn a certain amount or under, how you would just go to a sliding scale insurance that you can choose the plans and pay monthly from there. Keep in mind there's still co-insurance, which means you pay a percentage of the bill, and co-pays, which means you pay like $15 or something when you go to the appointments. Keep those costs in mind, but you can check out the differences between each plan. Covered California, it all has to be done through Covered California. Some more resources are the LA LGBT Center if you're queer. Don't go there if you're straight. Please don't. No offense, but there's safe places for straight people everywhere else. So I would say don't use the resources as much if you're straight. You can donate. You can donate, but the appointments are really booked and busy. So I just please don't. You're safe elsewhere. Some other resources are My Healthy LA if you're undocumented. So a lot of these programs and things might affect you if you're undocumented. If you need more help, go to My Healthy LA. And also we found on Instagram last night a queer-oriented, it looks like maybe virtual, or they at least deliver medications, especially like hormone medications for queer folks, for trans folks. It's called Folx Health, Folx Health on Instagram. on Instagram. Y'all got me cracking up. So again, I have this whole layout on Patreon. Go ahead and go there. It's free. If you want to sign up, I'd really appreciate to keep continuing this work and sharing. If you have any questions, you can let myself know. You can let my partner know, Dirty Laura, on Instagram, because we're down to answer questions for anyone, because this information isn't normalized yet. And it should be. And a lot of people are going without care because they assume, like I did, that it's not there. Or it's $800 a month. It's just never going to happen at that price. So please don't wait. Head over to patreon.com, Stay Light with Liz. And if you want to join us this Friday, my dad has a mindful coaching program, business services. So if you're feeling stuck in your position in life, or stuck on a situation, or you have a certain goal you really want to reach, but you're like, you're looking for some structure, some accountability, some guidance. He's super certified and trained and super funny. Like, you think my I'm funny or giggly or bubbly, it's from him. It's literally from that side of the family. So that's Friday. It's a free event just to check in, like, what is mindfulness? What does mindfulness look like when you're goal setting? And we'll do a little demo there. That's 5 p.m. PST. That'll be on Patreon too, the information. It's going to be via Zoom, though, when we're live streaming. That's this Friday. Awesome, y'all. This has been fun. A lot of talking. I feel like hype. I feel excited. I feel like we're, like, breaking down barriers, and I feel like I'm doing so much better, and it's because of this self-care stuff. It's been a long time in the making, and finally in a really good place. So I wish you the same. I wish you nothing but love, light, and peace. And if you need anything at all, just let us know. I'll see you for yoga today at 4 p.m. from everybody, Los Angeles. And hope you stay light. Bye, friends.